Sprains and strains are a very common injury that affect muscles and ligaments. Ligaments are strong bands of tissue around joints that connect one bone to another. Injuries like this usually happen as a result of physical or sporting activities. Symptoms of sprains and strains include the area becoming painful, swelling and inflammation, and loss of movement in the affected body part, but both are slightly different. A sprain occurs when one or more of your ligaments has been stretched, twisted or torn. It is recommended that you should not stop using a sprained joint because the injury will heal quicker if you begin to move it as soon as possible, but avoid overusing it. A strain occurs when the muscle fibers stretch or tear along a limb. The advice for muscle strains is different. For the first few days afterwards, you should stop moving your injured muscle and keep it still. The length of time you should keep the muscle immobile will depend on how severe your injury is. Most mild to moderate sprains and strains can be treated at home by following some simple self-care techniques and taking some painkillers such as paracetamol and anti-inflammatories such as ibuprofen. It's important to protect the injured from further injury by using support such as lace-up shoes that enclose the foot when walking around. Resting the injured foot is also essential, but small movements should be attempted in the case of sprains. Applying ice wrapped in a towel for 15 to 20 minutes at a time every 2 to 3 hours is also a good idea, as are Tubigrip bandages, which can help limit swelling in the early stages. Lastly, elevating the injured area can also help to reduce the swelling too. Avoiding certain things is also important. Things such as hot baths or excessive heat, alcohol, running and massages can often do more harm than good. So stick to the price therapy to help the injury recover quickly. Whilst most injuries can be treated at home, occasionally you may need to see your GP or use the out-of-hours service if your symptoms don't get any better. They can give further advice and treatment. However, if you cannot move or put weight on the injured joint or muscle, or if it has crooked lumps or bumps forming, or you fear you may have broken something, you should go straight to accident and emergency as you may need an X-ray. There are plenty of services available where you can be seen quickly and conveniently, so think about it and choose the right care.
After an injury, you can relieve pain, reduce swelling, and promote healing with the RICE treatment. Stop using the injured body part as soon as possible and avoid any activity that is painful or may have caused the injury. Apply ice or an ice pack to the injured area for the first 48 to 72 hours following an injury. Use a barrier between the ice and your skin. Apply ice several times a day for 20 minutes at a time, followed by 1 hour off. Wrap the injured body part firmly with an elasticized bandage, compression sleeve, or cloth. This will help speed up healing time by reducing swelling around the injury. Elevate the injured body part above the level of your heart to decrease swelling and joint pain. As with any injury, if it does not start responding within a day or two, or you suspect there may